How you doing? And welcome in, everybody. My name is Brian Essenter. I'm a cannabis pharmacist, and this is the Pharmacist series for the United Patients Group. This is our second video, and today we're going to go through a few questions about what the dispensary experience itself is going to be like. So, again, if you have any questions, please feel free to send them in. We'd be happy to hear your questions and see if there's something new that we're getting that we haven't answered already. We'd be happy to answer them for you as well, because I'm sure everybody else will have questions too. So today, we're going to start with what type of questions they ask at the dispensary. We're going to go through the differences between indicas, sativas, and hybrids, and how relevant that really is. Do I need to smoke? And if not, how do I consume? And do I need to get high? So when you go into a dispensary, you're going to get asked a lot of questions. It can be very overwhelming and just nerve-wracking to walk into a dispensary. It's a little weird for some of us that this has been illegal most of our lives, but it's legal now. It's okay. Nobody's going to get arrested for walking out. But they're going to want to ask if you know what you're looking for. So again, as we mentioned in our first video, if you go in with a pretty good idea of what you're looking for, that's definitely going to help the process go a lot smoother. Next, if you're not really sure, the next question that you'll get is, well, do you want a sativa, an indica, or a hybrid? And most of us in the cannabis industry hate this question. We think sativas, indicas, and hybrids are very obsolete names and terms at this point. There is much better ways to talk about cannabis that are going to give you much more accurate indications as to what to expect from each particular product that you get. But we'll go through some of that in just a minute to help you understand and be comfortable having that conversation as well. Again, know how you want to consume cannabis. Do you want to smoke or vape? Do you want to use a tincture sublingually under the tongue? Do you want to use a capsule or a tablet or other edibles? Would you prefer to use something topically as well? So there's a lot of different ways that you can consume, and having an idea of what you're looking for will definitely help that. And again, what symptoms you're looking for relief of. That is going to give you the best results when you talk to these people at the dispensary, because if you can be more specific with the symptoms you're looking for relief of, as opposed to being concerned about, am I saying the right sativa, indica, or hybrid, that's going to be much easier for the bud tender or whoever to pair you with a product that is going to be appropriate for what you're looking for relief of. So in that vein, the differences between indica, sativas, and hybrids. So some of the silly basic ways to remember it, sativas are going to be your daytimes, are typically more uplifting, help with focus, creativity, and are a little bit more energizing. Indicas are the complete opposite. They're going to be more sedating, help with more pain relief, anxiety, sleep, that kind of a thing. Easy way to remember the differences, some silly ones. Sativas are in the head, indicas are in the bed, and indica in the couch, because that's where it'll put you. Those are two silly little things to help remember. And then your hybrids are just typically a mix of the two, a cross of indicas and sativas. Now they can be crosses of anything, but in general, your hybrids are going to be, more of your afternoon strains, or what people are referring to them as. So something that's not going to be as sedating as an indica, not as energizing or uplifting as maybe what a sativa would be. But something more afternoon, evening. You're not going to knock out, but you're still going to get the anxiety relief, pain relief, and be able to still be present for dinner, family time, anything like that. So that's typically what you're looking for there. Again, being more specific as what time of day and what symptoms you're looking for will definitely help. But everywhere you go, you're still going to see these terms. So you want to at least know what you're talking about in order to help figure out, so you make sure you're having the same conversation as the bud tender and don't leave with a product you weren't intending. And then, of course, one of the biggest questions that we get asked all the time is, do I need to smoke? And if not, how do I consume it? Everybody has only really ever known cannabis to be something that's smoked. That's been, how it's been consumed for centuries now, at least as much as we remember. However, there are tinctures. So you have cannabis oil in either ethyl alcohol or maybe an MCT oil or a coconut oil base. and that can be used orally. So you can use it in a drink, you can use it under your tongue. So, that really will help there too, and can really help you adjust your dosing with 1 or 2 drops in one direction or the other. You also have your edibles, your tablets, your capsules, your brownies, your cookies, all of those kinds of things too. Those take a little bit longer to kick in. So that's what you want to remember about those. And then besides your smoking, you do have vaping. Vaping is a little bit different. You want to make sure that they're pure oils, that they're not cut with any thinning agents, flavoring agents, anything like that. Those are the ones that are going to cause the problems and potentially other health risks that you can have with that as well. But you're not getting all the combusted materials and everything with vaping that you do get with smoking. So it is a little bit better there, and it does have a very quick onset. That how quickly they kick in, how long they last, that is the biggest difference between all of the different delivery methods. If you're smoking or vaping, usually kicks in very quickly within about 10 minutes or so, only lasts maybe 2 hours, 3 hours. If you're using a product sublingually under the tongue, that's going to, if you leave it there for about 30 to 60 seconds, typically, it'll kick in about 20 minutes or so, last maybe 4 to 6 hours or so for you. And then finally, orally, if you use a drug, as a tablet or a capsule, or if you swallow a drink with a tincture in it, that can usually take longer. And depending on your metabolism, anywhere from 30 minutes up to 2 hours, can last from anywhere from 6 to 12 hours for patients, depending on their metabolism. So you want to be very careful with which delivery method you use, and understand that you can always use more, you can't use less. So, don't forget, you can always adjust your doses up. But, that leads us into our final question of, do I need to get high? And the answer to that is no, you don't need to get high. Getting high is a side effect of using cannabis, and specifically THC. Just like any other medication, side effects are dose dependent. Now, some of us are a little bit more sensitive to THC than others, so we might have to start very low and go slow. And, you can build tolerance to the side effects of these medications. So, if you start slow over time, you can get used to how these medications make you feel, and slowly increase the dose in order to get the relief that you're looking for. You can also do things such as adding CBD to your THC, which will kind of take the edge off of the THC for you, or even having a CBD dominant product will help build some tolerance to THC as well. And taking THC at nighttime for bed, for sleep, will definitely help build some tolerance while you sleep it off. So that's definitely something to think about as well. So thank you so much for tuning in to this latest episode of Ask the Pharmacist for the United Patients Group. We look forward to seeing you next time. And like I said, if you have any questions, please feel free to reach out and send them in. If we get some new ones or something that we haven't answered before, we'll be happy to help inform everybody again. Thank you so much, and have a great day.